Hi there, I'm Quinn Donne, the Gateway Projects Coordinator with Family and Community Services in the city of Albuquerque. I'm sure many of you are already aware of the homelessness crisis that's gripping our city and that's very visible. But have you ever wondered what happens if somebody is medically fragile and doesn't have a place to live? Have you ever wondered what happens if somebody needs to recover from a procedure and they don't have a place to live? Well, stay tuned because today on our webinar series, we have a lot of valuable information to consider regarding medical respite and what it is and how it can help our most vulnerable unhoused populations. I'm here today with Rachel Biggs, who works with Healthcare for the Homeless. Rachel, I was hoping you could tell us what you do at Healthcare for the Homeless and what it is Healthcare for the Homeless does.
Hey Quinn, thanks for having us here today. I am the policy director at Albuquerque Healthcare for the Homeless, so I work on our public policy and advocacy at the organization. And Albuquerque Healthcare for the Homeless is a federally qualified health center here in Albuquerque. We serve all of Bernalillo County, and our services are exclusively for the population of people without homes throughout Bernalillo County. We provide integrated primary medical, dental, behavioral health, and social services. And our services are delivered through really extensive outreach throughout our community and at our central services campus, which is just north of downtown in Albuquerque.
Wow. So it sounds like you all are right in the thick of it. And as policy director, what are some of the main things that you focus on?
So in my role as policy director, I am really fortunate to be able to work at the city, county, state, and federal level on public policy. This is really essential to the work that we do at Albuquerque Healthcare for the Homeless because it's part of our mission and who we are to change the systems that create homelessness in the first place. We really believe that homelessness was created through kind of intentional public policy that's happened over many decades. And because of that, it can be changed through good public policy. So my role is to inform and educate and advocate for good public policy to address things like affordable housing, paying a living income, and of course, access to affordable healthcare.
That is really powerful stuff to change the system through positive policy making. I really appreciate that outlook. So that's a really great segue into the question, Rachel, of why do you do this work? What brought you to doing policy work involved with people experiencing homelessness?
Yeah, it was a really natural fit for me coming to Albuquerque about 6 years ago. Prior to being in Albuquerque, I worked in the Middle East in human rights and humanitarian assistance programs. And I really saw what happens when there isn't a good policy to address human suffering and need. And when we're just delivering services in a vacuum without addressing the higher policy implications and changing the systems that's created what we have in the first place. And so when I came back to the States and landed in Albuquerque, I was looking for an organization that was really focused on social justice and human rights. And that is exactly what Albuquerque Healthcare for the Homeless is about. So for me, homelessness is an issue of human rights and social justice and something that I'm really passionate about in my work. And I've been able to translate my work abroad here in Albuquerque to the work that we do and inform public policy and make sure that we're really working on systems and solutions that will end homelessness and not just perpetuate it.
I love that because, it is so impactful how a policy can change things and you've seen firsthand what it does without it. And so for you to bring that lens to Albuquerque and really be on the front line of helping make change in this city, that says a lot about your willingness to just dive into this work. So I'm glad you came. I'm glad you came to Albuquerque and stayed. So I think what I'd like to talk about next, Rachel, so part of the Homeless Coordinating Council, as you know, we were charged with coming up with high impact strategies to help meet the need of our unhoused populations here in Albuquerque. And one of the needs that we uncovered, and I'm sure you already knew a lot about this, was our need for medical respite just our need for medical respite. And so I was hoping that you would be able to tell us a little bit more today about what exactly medical respite is and what that need is in our community. How do we know we need it?
And that's exactly where Albuquerque Healthcare for the Homeless comes in, because we really work at the nexus between housing and healthcare, and medical respite brings these together. So what we know about the experience of homelessness is that poor health can cause homelessness, and then homelessness, the experience of it, can also exacerbate existing health conditions and cause new health conditions. We also know that people experiencing homelessness really have high rates of acute and chronic illness, and recovery is so much more difficult when you do not have a home. Housing is one of the most basic and powerful determinants of health. Medical respite is a really high impact strategy because it's really getting to the core of the issue of homelessness, addressing health issues and housing at the same time. So medical respite essentially is the idea that you are perhaps hospitalized for an illness. So say you've been in the hospital for pneumonia. Typically, when you have a home, you are going to be discharged with instructions to go home, rest and recover, hopefully have someone look after you and provide you with that comfort and support of a home. In the case of someone experiencing homelessness, you're still going to be discharged from the hospital because you're not quite sick enough to be hospitalized anymore, but you won't have the comfort and the dignity of recovering in a home. And that's where medical respite comes in. Medical respite is a model that is throughout the country. We have medical respite facilities in almost every state across the country at this point, a lot in California. We have a few respite programs here in Albuquerque that provide kind of a social model of respite. So people have a bed to go to and a shelter and can recover. The thing that's missing here in Albuquerque is that next level of care where you add in really high level medical care. So we're wrapping around medical services with those social services to help folks transition from a medical respite facility into hopefully a permanent housing situation. Here in Albuquerque, we've been working on this issue for quite some time. We've been advocating for medical respite for many years. We started in July 2017 with a needs assessment, and this needs assessment brought together a work group of our partners. So we worked with Barrett Foundation, the City of Albuquerque, Department of Family and Community Services, and Heading Home, and Albuquerque Healthcare for the Homeless, to start thinking about what medical respite could look like here in New Mexico, but specifically in Albuquerque. And this initial needs assessment really gave us a good lay of the land of the resources that we had available for folks exiting the hospital to rest and recover at the Albuquerque Opportunity Center, at Barrett Foundation, and at Good Shepherd. What we realized was that the pathway into those recuperative beds, that kind of social model of care, was one directional, and not many people could refer into those beds. They were contracted by managed care organizations or hospitals, and we wanted to expand that first and foremost. The second thing we wanted to do was expand the level of medical care that's available for individuals that are recovering. And so from that needs assessment, we were able to keep gathering information, and we've built up a pretty robust amount of data now to show exactly the needs that we would be treating in a medical respite care facility. Medical respite care is short-term, so it's not like a skilled nursing facility or nursing home or assisted living, where I think a lot of people would say, oh, well, you're discharged from the hospital, you could go to a nursing home or skilled nursing facility. The purpose of medical respite care really is meeting that need of someone that would just go home to recover, and that recovery would be pretty time limited. What we see nationally on average, a length of stay at a medical respite facility for someone experiencing homelessness is on average about 30 days.
So is there a easy path generally from medical respite to permanent housing, or is that another system's need?
That's a great question. And so I think one of the reasons why we have spent so many years working on a medical respite model and system in Albuquerque is because of this need to really emphasize the transition to permanent housing. We really don't want to pursue something that's not going to be focused on a housing pipeline, and really have that housing first approach. First and foremost, we'll address your medical needs, but really we're looking to get you into permanent housing as soon as possible. And that requires having resources available to transition folks, typically with housing vouchers, sometimes with dedicated housing vouchers. It's been done differently in different communities, but this is really the crux of the issue with medical respite and why it can be such a high impact strategy for the city to pursue. Because when someone's in medical respite, we have their undivided attention. Someone's recovering from a medical illness, an acute illness, something that is, like I said, time limited, that can be treated within a relatively short amount of time, but they're there. We have a captive audience where our social services teams can really come in and wrap around that individual, work on things like benefit enrollment, income supports. If we can get someone onto SSI, supplemental security income, or SSDI, disability income, we're increasing the income that they have available to them immediately. And sometimes individuals with that and other income they have available, we're able to find them an affordable apartment in the community and really transition them into housing very quickly. Sometimes they're going to have really high medical needs, and so they are oftentimes prioritized for our housing vouchers. And being a very vulnerable population, we are seeing an aging population. We're seeing, at least at Healthcare for the Homeless, our census numbers, it's not huge jumps, but in our population of people over 65 years old, it's growing every year. So we are seeing this aging population. And of course, when we are talking about the health needs of an aging population of people experiencing homelessness, that means more complex health needs, more need for medical respite care in the future. We also know that someone experiencing homelessness will live, on average, 30 years less than someone that is housed. So for us, this is really a moral issue as well, and a really imperative issue to be able to provide medical respite care to stop that cycle of early mortality and morbidity among people experiencing homelessness.
Wow, Rachel, what I hear in that is, healthcare for the homeless really pushes that dignity piece of how can we help folks that are older, that are suffering from some sort of illness, be comfortable, and also get them to a place where they will have the rest of their time here be comfortable, whatever that looks like for them. And I'm not sure, if that question is thought about very deeply. And I'm so happy to hear that you are all really at that true intersection, like you mentioned. So let's for a second pretend that I don't know anything. What happens now if somebody goes to the hospital and they don't have a home and they do need to recover, but let's say none of those social recuperative beds are available at any of those shelters? What happens? Where does the person go? What happens?
That's a great question. And one of the reasons that medical respite care has been embraced by hospitals as well is because hospitals are also in a hard position, right? If there's nowhere to discharge folks to, but typically they're not quite sick enough to be there, what is that hospital supposed to do in that case? So it's not really the fault of the hospital system either. It's how our system is set up right now, and the lack of resources to support folks when they are discharged from the hospital. What we do know about medical respite care is that it addresses some of these needs for the hospital as well, because we know people experiencing homelessness will on average have a hospital stay 4 days longer than someone that's not experiencing homelessness. They have higher rates of readmission. So that means once they're discharged for one illness, they might be readmitted within 90 days for that same illness, which we don't like to see in the hospital system. It's not a good use of resources, and it's not good, obviously, for the client as well that is experiencing that illness that should have been able to recover quicker had they not been on the streets. So right now, if there's not a bed available at one of these recuperative care places like the Albuquerque Opportunity Center, Barrett House, or the Good Shepherd, individuals will come to maybe Healthcare for the Homeless or First Nations or other federally qualified health center that has an HCH program, a Healthcare for the Homeless program as well. And we have a resource called motel vouchers, and motel vouchers can be used as a form of medical respite. It's not a sufficient form of respite, but it does provide someone that safe place to recover. And a lot of the data that we've gathered for our needs assessment comes from that motel voucher program, where we're able to refer folks when they're recovering from a medical illness. Again, that's short-term and time-limited. We can provide a voucher for that individual while they recover, so they don't have to recover on the street. At the very worst case scenario, individuals are going, if they're not connected to a provider or we're not seeing them on our outreach, we try to reach as many people as we can on our street medicine outreaches throughout the city, but then they're forced to recover on the street. And it's, as we know, that's not an optimal place to recover from any illness. Something as simple as a cut on your arm can turn into a really nasty skin infection without having the resources that you need to keep that wound clean and dry. And being able to change dressings. So as you can imagine, being able to recover on the street is next to impossible and really not acceptable in any situation.
When someone is in a motel voucher recovery room, let's say, is there medical staff that comes and visits them daily? Does the street medicine team go to see them?
So our street medicine team does follow up with individuals. We try to follow up with our social services team as well. So it truly is a type of respite model because we're combining our integrated teams of medical and social services care. But again, it's not that ideal scenario because ideally someone would be in a 24/7 facility where they had medical respite care regularly coming through, checking in on them once a day. They're in a really stable space. And we don't really have that in a motel environment. At least they have the stability of being in a safe place and are connected to their primary care home, whether that's us at Healthcare for the Homeless or another primary care home throughout the community. We make sure that those connections happen and work really hard on that. But ideally, individuals would be in a medical respite facility where they would just have everything they need there. They would have healthy meals brought to them 3 times a day, really essential part of recovery as well. And then that ongoing social services support to think about what housing plans look like, taking housing assessments, benefit enrollment, and working on any kind of other income supports that we can work on in the meantime.
Wow. So you definitely are doing a coordinated, truly wraparound approach at your agency with these individuals that you come in contact with.
Yeah, that's
very
really
holistic.
Exactly. That's really core to that. The Healthcare for the Homeless model is really a movement. There's about 300 Healthcare for the Homelesses across the country. The model started in 1985, and we were one of the original 19 Healthcare for the Homelesses across the country. So we're one of the original here in Albuquerque, which is pretty exciting for Albuquerque, New Mexico. And we've seen this really grow into the movement that it is today. And what we say is that the model of care that Healthcare for the Homeless provides and advocates for is really a good model of care for anyone. It works for everyone in our communities, this integrated, holistic model of healthcare.
Absolutely. It sounds like you have a really great system, and I'm glad this is part of a national movement, that it isn't just isolated here in the Southwest. So that's fantastic. And I'm curious, what are the top 3 medical situations that would land you in a need for medical respite? Just because I think people, would like to understand that a little bit more.
Yeah, so what we did at Healthcare for the Homeless, we looked again at our motel voucher data. So the top reasons that we were referring individuals for our motel voucher program and why we were referring them. So when we looked at the data, we saw the top 3 reasons for referral. The first one was skin infections. The second one was an acute illness, so something like the flu or pneumonia. And the third one was acute pain. And then the fourth one was assault or trauma. And when we looked at that data, we weren't very surprised because this does track with what we see nationally for top reasons for referral to medical respite programs. They all kind of vary a little bit based on community need, but in general, pretty close. So that first category, it accounted for about 17% of all of our referrals. So 17% were those skin infections. So like I said, something as small as a cut on your arm can become infected pretty easily when you're living on the street and can turn into a pretty severe bacterial infection that does need to be treated around the clock with care. And it's really almost impossible to be able to address a skin infection while on the street. We can do what we can by providing street medicine outreach, providing socks for individuals so they're not putting on dirty socks all day long, and reinfecting a wound on the foot perhaps. But really what's needed is to be in a safe environment to be able to have that wound heal. The acute illnesses accounted for about 15% of all of our referrals, and that was closely followed by acute pain. So again, in this situation, when we say acute illness, it's something that's short term. It just came on suddenly. It typically could be resolved with short-term treatment. But what happens, especially with this population that we're talking about, is that you have an acute illness that's not treated quickly and effectively with a home in place. It's going to turn into a really long-term illness and could lead to death. And then the last category that kind of jumped out at us was the amount of people that were being referred for some sort of assault or trauma that they had suffered. We know that people living on the street are at really high risk of violent victimization. Someone living on the street is 25 times more likely to be a victim of violent victimization. And we see that in our data. We see that when we are referring people for our motel voucher program that are recovering from a physical assault, some sort of trauma to their to themselves. And that is something that is a real need when we talk about just investing in housing and medical respite care. Once we get people off the street, they're in such a safer environment, and the risk of violent victimization obviously goes down quite significantly.
Thanks so much for highlighting that, because I really want, folks to understand that all of us with homes, like, we are really that close. If we did not have a home, how quickly it could be to recover from something if we could get victimized on the street, etc. And so knowing the deep, deep importance of having a safe, emotionally safe and physically safe place to be and recover from some of these things is extremely important to this system. So thanks for all of the great work that you and Healthcare for the Homeless are doing. And I really hope that the city can move forward with medical respite in our community. Thanks, Rachel. Thanks for coming.
Thank you. Yeah, thanks for having me. I'm really excited to have the opportunity to talk about medical respite and think about the needs of people experiencing homelessness, especially the health needs of people living on the street. So thanks for this time.
Of course, because, we don't always want to be talking about behavioral health. It is very important. Medical health often is overlooked in these instances too. So I appreciate you bringing it up today. So wonderful conversation with Rachel Biggs, Director of Policy at Healthcare for the Homeless.